Hi everybody, this is Dr. Ihab Abdurrahman, Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum, dean of Sama Institute of Health. We are still doing our sessions in basic emergency care course. This about altered mental status. Objectives of this session: by the end of this session, you will be able to perform secondary survey by sample history and secondary exam to recognize key history findings suggestive of different causes of altered mental status. List high risk causes of altered mental status. Describe clinical action to manage patient with altered mental status, and then consider the disposition and transport of patient with altered mental status to appropriate facility or geographical area. Altered mental status is a term used for a range of presentation, sudden or gradual change in behavior, disorientation, confusion, irritability, stupor, coma. It could be due to conditions that arise from the brain itself, like bleeding inside the brain or brain abscess or tumor, or from condition affecting the brain like hypoxia and hypoperfusion, hypoglycemia. Can be chronic psychiatric problem or dementia, but we must rule out life-threatening causes first. Delirium always requires full assessment, and definitely you need to ask a family or a friend about the baseline mental status. The goal of initial assessment to identify rapidly reversible causes of altered mental status and recognize dangerous conditions requiring transfer. The goal of acute management to ensure that there is good and adequate oxygenation, adequate perfusion, good blood glucose, that blood oxygen glucose reaches the brain, and to protect the brain from additional injury. Always, whenever you get an acutely or critically ill patient, you need to do the ABCDE approach. Whenever you find a problem, you fix it. You do this in the primary survey. After you stabilize, then you go to the secondary survey. As usual, we take the sample history, symptom and sign, allergy, medication, past medical history, last oral intake, and events surrounding the condition. After that, we proceed to secondary examination. During this process, whenever you discover a problem, you go back to ABCDE and fix it. In the sample history, in the sign and symptoms, you need to ask a family member or a friend what is the baseline mental status and what change did they observe. So the current condition, how much it differ from the baseline clinical condition, clinical status. And if the altered mental status is associated with difficulty in breathing, consider hypoxia. Ask if there is headache, vomiting, or diarrhea. Vomiting and diarrhea with significant dehydration, it leads to hypoperfusion and can lead to altered mental status. Headache alone or headache with vomiting can point to intracranial infection or tumor or bleeding inside the brain. And also patient with vomiting and diarrhea might have hypoglycemia. Ask if there has been any dizziness, because poor perfusion can lead to dizziness. And at the same time, you want to make sure if there is any source of fluid loss. When did the symptoms start? And how long they last? And how they change over time? Rapid onset of symptom, it point to intracranial bleed or infarction, exposure to drug overdose or certain toxin or even allergic reaction. And also it can happen with inflammatory process and infection. Gradual, think about tumor and slow bleeding inside the brain, while intermittent, it can happen with seizure, convulsion, and psychiatric illnesses. Fever, it can raise suspicion of infection, meningitis, encephalitis, brain abscess, meningoencephalitis. In children, it can lead to febrile convulsion, and also exposure to heat stroke, and also poisoning with and drug overdose. This can lead to fever and altered mental status. Weakness, clumsiness, difficulty in walking, consider stroke or tumor, and it can also happen following trauma and subdural hematoma. And you need to see if there is any neck pain or neck stiffness. Any recent history of trauma, bleeding inside the brain, or like subarachnoid hemorrhage or subdural, epidural, all these can lead to neurological changes. And also alcohol intake, it increases the risk of trauma, and sometimes it could be trivial trauma. And a patient with alcohol can have at the same time some liver disease and derailment of their liver function, and they might not remember a fall or trauma. Ask for recent depression or change in behavior, and think about drug, alcohol, psychiatric illness, and also ask about suicide and attempt to self-poisoning. Does anyone else from the same family has the same symptom? Because here it can reflect that exposure to the certain poison, like in carbon monoxide poisoning. Allergy itself can affect the brain through hypoxia, through hypoperfusion. Medication, ask about chronic medication, any new medication or any change in dose. Like pain medication like opioid, morphine, amphetamine, and heroin can affect the mental status in drug overdose. Sleep medication also can affect the mental status. Those on seizure medication, if they stop it, they can have seizure, and also they can have side effect. Look at the past medical history of diabetes. Diabetic are prone to hypoglycemia or even diabetic ketoacidosis or hyperosmolar status, and then you assess the fluid status and degree of hydration. In the past medical history, ask about heart disease, because heart disease is the risk factor for heart disease are the same risk factor for stroke and cerebrovascular accident. Hypertensive can present with hypertensive encephalopathy or intracranial bleed or subarachnoid bleed. And also patient with heart failure might have shock, and this lead to brain hypoperfusion. History of seizure, do they take their medication regularly, any change in their medication, and any history of recent trauma. Usually after seizure they recover slowly, the post-ictal state, but if it is get so prolonged, consider other causes. HIV infection like HIV, tuberculosis, these come HIV can they can develop other infection, meningitis, encephalitis, and some opportunistic infection. Tuberculosis itself can affect the brain. Those with heart and with liver disease and kidney disease, they can have hepatic encephalopathy or uremic encephalopathy, and all these can lead to altered mental status. Use of alcohol or drug, because they can have intoxication because of drug overdose or alcoholic intoxication, and they can go into withdrawal feature, and this can lead also to altered mental status, and at the same time they are subjected to trauma, and sometimes they can be using these patients can be using sedative or hypnotic medication at the same time. A pregnant lady, when they have high blood pressure and edema and seizure, it can be eclampsia You should ask your patient when was the last oral intake, because this could signify hypoglycemia. And events surrounding the illness, because trauma could be a factor, and seizure also could be a factor, or even exposure to certain toxins like in carbon monoxide poisoning. Recent exposure to sick person, insect bite, or chemical exposure, or drug or alcohol. Sick contact can suggest infection, chemical exposure, pesticide can suggest poisoning, bite and envenomation. Exposure to extreme temperature can lead to heat stroke. Drug ingestions can lead to agitation, lethargy. Alcohol intoxication and withdrawal also can be a factor. Thank you. We'll continue in the next session.